the topic today is imaging infertility. This is a big topic, right? It has got multiple parts, and I'm going to take it in parts because every part itself is like a topic, right? So, in order to have a good discussion about each part, today we are discussing about part one, and we are going to start with what is infertility, right? So, the definition of infertility is what we all must know. When the patient visits us, then we should know that what the patient is talking about. If the patient says infertility, whether the patient fits into the criteria of infertility or not, right? So, uh, by definition, if the patient is unable to conceive after 12 months of unprotected intercourse, it is called as infertility, right? The job of a clinician, of a clinical radiologist, is to identify the treatable causes and to guide the management, right? So, this is something which is important. So, we are going to go towards identifying the treatable causes and thereby radiologically guiding towards their management. So, we'll divide it into actually two parts. First of all, depending upon the etiological factors. So, the gender based classification is either the male etiological part or the female etiological part. And then we have the hormonal causes, which again could be divided into two parts like male and female, right? So now female morphological causes, something that comes to us for imaging. Okay, includes, I've divided it into four parts, right? So ovaries, uterus, the tubes which connect the uterus to the ovaries, cervix and vagina. What today we are going to discuss is about the ovaries, and we are going to go ahead with the case scenarios, right? So specifically, we are going to talk about the ovarian scenarios which cause infertility, and which could be diagnosed on imaging, which are radiologically important for which the patient might come to us. So we are going to go ahead with case scenario one, and we have a 15-year-old female patient with normal secondary sexual characters, but she complains of amenorrhea slash she has not achieved amenarche yet. So my first question to you is whether it is primary or secondary amenorrhea. And my second question is how would you like to evaluate? Please put up your answers in the chat box. And I hope everybody is going to put answers in the chat box because that's how that's how it is like a two-way conversation. That's how it gets interesting. So don't shy off. So, okay. Opsonized Fago hasn't changed his name, right? His or her name. I don't even know. It's still opsonized Fago. Okay. So, the kind of the amenorrhea that we are talking about is a primary amenorrhea, right? And as per a few of you, the modality of choice is going to be ultrasound. So, like the first modality, I would not say modality of choice, but the next modality that the first line of investigation or the modality will be an ultrasound. That's correct. So primary amenorrhea, by definition, is having no history of menstruation by the age of 15 years or 3 years after having breast development or thelarche, right? This is something that we must know clinically. And secondary amenorrhea is defined as absence of menstruation for more than 3 months in a woman with previously regular cycles. So yeah, so if she had regular cycles, then 3 months enough, or she should have a 6 months of amenorrhea in any women who actually had at least one previous spontaneous menstruation. So maybe for irregular cycles, you can consider 6 months, or if the patient comes and says, "I was having regular cycles, but since 3 months I've not had them," then it goes into the category of secondary amenorrhea. Right. So the clinical scenario, the case scenario that we're talking about is a primary amenorrhea. Correct. So now let's move ahead. We do an ultrasound and we see these tiny structures, right? So what are we looking at? What are we looking at? Ovaries. So do they look normal or do they look abnormal? So in terms of size wise, if you're, yeah, so they look atrophic, they look small in size. They're like almost 1 centimeters. They're very small in size, right? So any clues where we are heading to? What would you like to put up in your report? Streak ovaries, very good. And streak ovaries and? So what would you like to see in the patient morphologically? Turners, very good. What are the features of Turners? What would you like to see morphologically in that patient? Web neck, perfect. Short stature, perfect. So that's something that when the patient walks into your room, low hairline, very good. So hairline is something you might not have focused on first, yeah. But then short stature is something that is something that you can see very well when the patient walks into your room, right? So always keep an eye, keep an eagle's eye when somebody comes into your room. A lot of diagnosis could be made then, right? So this patient when came into your room was definitely short statured, was having a webbed neck, and then we saw these ovaries, and she complains of primary amenorrhea. So maybe we are moving ahead with Turners, right?